We've seen that the American health system was ill-equipped to deal with a pandemic of this size and this nature. Instead of leading the world, we had the most deaths of any country. Our infection rate did not drop the way it did in all the other rich countries of the world, and our economy is in free fall. So what happened? So an interesting thing that we've learned about virus economics is that the virus has basically substantially accentuated a bunch of the disparities that already existed in the economy. If you look around the country right now, people are erupting in protest, shedding light on injustices and inequalities and the disparities that exist between communities. And that is mirrored in our access to the healthcare sector, especially so during the COVID-19 crisis. In a lot of low-income communities and communities of people of color, a disproportionate share of people work in essential occupations where they're getting exposed to the disease at much higher frequencies than are people who are working from home in higher income neighborhoods. So if you look in major cities, within New York City, rich neighborhoods versus poor neighborhoods vary in their death rates by a factor of 5 or 10, just 1 mile away from one another. So these disparities, as I say, they've gotten worse, and it's really put it at the forefront of our reaction to this crisis. The healthcare system in the United States has been failing in a couple of ways. We all know we had a shortage at the start of the pandemic getting tests to COVID-19 patients. And that's a real shame, because that is when we needed tests the most to identify who was infected to slow the spread of the virus. The shortage of adequate personal protective equipment forced the first responders and medical personnel to deal with sick patients without the gloves and the masks and the things they needed. In some cases, they were literally wearing garbage bags to deal with the crisis, and that led many of the first responders to get sick with COVID-19 themselves. What we are facing is a systematic problem with healthcare in the United States, and it's affecting tens of millions of people, and it's why the COVID-19 crisis is as bad as it is. It's not just because the virus is contagious. If our healthcare system were designed differently, we could have handled this crisis in a better way. Because ultimately, stronger health equals a stronger economy. Not having universal coverage is like going to war without any battle armor. If we are not all protected, then we are much more vulnerable as a country to getting sick. With millions of people not being covered, means that when you get a contagious disease, we're only as strong as our weakest link. Because healthcare in the United States is so expensive, that also becomes a barrier. In Europe, if you go to the doctor with COVID, your out-of-pocket expenses is zero. In the United States, the average hospital visit for COVID costs $30,000. So think about the decision that somebody without insurance has to make. And employer-based healthcare, where your healthcare comes from your job, that might work in a normal circumstance, but not during a virus recession. We're now facing the steepest unemployment of our lifetimes, and anybody uninsured is going to be directly on the hot seat trying to figure out how to pay their medical expenses in the middle of a massive pandemic. If we could come up with a vaccine, if our thousands of scientists and our medical innovation sector in the United States or anywhere could come up with a vaccine for the disease, we really could get back very much to the economy that we had before this whole thing came about. Now, don't kid yourself. To come up with a vaccine is going to cost billions of dollars. It's very much in our interest to have the government pressing to help with the manufacturing and discovery of this vaccine, and also helping everyday Americans with whatever the cost is going to be to get this vaccine. So will the economy and will the healthcare system learn these lessons from this crisis so that we don't have to just repeat these mistakes the next time something like this happens? Let's hope so, because ultimately, stronger health equals a stronger economy. And we've seen that again and again in this COVID crisis.